For those of you that are online, my name is Julia Johnson. We kind of introduced ourselves here at the very beginning. I've been with Sanders Brown for roughly 5 to 6 years. I am going to talk about effective communication. Okay, so the principles, and this is kind of a general overview of the principles of good communication. Good eye contact. You always want to stay within eye level if possible. Descriptive language helps paint a vivid picture. Appropriate gestures and body language, and like I said, I'm going to go a little further into this as well. And always introduce yourself. It says err on the side of better communication. Even though it may be a family member or a spouse or someone that you know that knows you, still introduce yourself to them and address them by their name. Nonverbal communication, and that kind of goes to what I was talking about at the very beginning. Body language says everything. I think this picture really identifies with how that could have been perceived. How would you perceive this person in the picture? Fear. And even fussing, almost like she's fussing at someone. So when we approach someone, we got to be cognizant of the fact that that person is studying our whole body, not just what's coming out of our mouths, but what our actions. So looking for clues, facial expressions, and hand gestures. Positive body language such as a smile, a handshake, or a hug, it can go a long way. A welcoming, friendly face or expression can make all the difference. Make sure that you're having adult conversation. These are, the people that we're caring for, they are adults. And just like anyone else, we want people to recognize the fact that I make decisions. All of these things are done when I'm talking with someone, that my words are valuable. It's valuable to me just like it should be valuable to you. No baby talk. Simple but adult in nature, not using let us, addressing versus questions. We want to also make a statement, talk about something meaningful to the individual. They have a choice. Keep it simple. The clothes for the day, the daily activities, consider what they want. Now there may need to be some guidance, and there may have to be a different approach, as Kelly had talked about earlier. Some of the things that we do, we have to kind of guide in a different way. Find a method, study that person so that you know how to address them when you're trying to get certain things done. Utilizing their life story, empathizing and validating emotional needs. Behaviors, communicate messages, things they cannot understand or do. Be patient. This disease prevents the ability to find words, form sentences, and comprehending words spoken by others. We always want to take that into consideration. We have to slow down, make sure that we're speaking where they can understand. We try to relate to them in the way that they can understand what is being related to them. Avoid arguments and confrontations. This only causes more stress, frustration, and a sense of failure, triggering defensiveness and potential harm. And of course, you want to apply humor. Humor is a good source. Now, I am not a comedian. My husband is truly a comedian. He could make a joke out of absolutely anything. But for those that have that skill, share a funny experience, a scene of a movie, an old movie that you would know that they're familiar, and of course, telling a joke.